Hi everyone, I'm Dr. Gyaneshwari Raikar. Welcome back to my channel Newbie Docs. Today we are going to discuss the differentials of chest pain. Chest pain is a very common symptom that you come across both in the emergency department as well as in the OPD, but remembering the different differential diagnosis or questioning our patient who is in chest pain about the differential diagnosis is very difficult if you don't have them in order, at least from the most severe to the least severe, or at least the way I look at it, from each organ or each region of our chest, right? So if you look at our chest, we have multiple regions. So we are going to look at chest pain from that aspect, and we can split them roughly, more or less, to 6 different parts, right? So the first one you're going to think of is the heart, right? Of course, the heart. The heart, we are thinking of MI or ischemic causes, which is MI and angina. You're going to think of coronary vasospasm and myocarditis and pericarditis as well, right? Now the second system that you're going to think of is the lungs. In the lungs, you're going to look at pneumonia being a very important cause, pleuritis as well, but not forgetting pulmonary embolism as well as pneumothorax and tension pneumothorax. The next region we are going to look at is the mediastinum. In the mediastinum, we are going to think of the aorta giving us aortic dissection, which is an emergency, and the esophagus. Now, the esophagus classically is associated with retrosternal burning chest pain, which can sometimes progress to a profound chest pain, and this is associated with GERD. But don't forget nutcracker esophagus and as well as Bauhaave syndrome, which can cause acute chest pain. Finally, is it finally? Did I miss out on a number? Okay, let's move ahead. Now, let's go to the exterior, or rather a little bit to the exterior. We've done all the internal organs. We'll go to our chest cage, right, or our rib cage. So when you think about the rib cage, the bones and the musculature, think about costochondritis, which can occur after a flu, right? It is a sharp pain that comes in one aspect of the chest. Sometimes muscle pulls can also occur if you are lifting up heavy weights in that from your waist above. Okay, you can have chest pain. Third would be your rib fracture, which can cause chest pain as well. Now, thinking about the skin, you're going to think of our herpes zoster neuralgia, which occurs because of the reactivation of the chickenpox virus, which basically becomes herpes zoster. I don't know why we name them differently. I think if you know, if I'm missing out on something, please let me know. However, that can cause chest pain as well, but it is usually unilateral, and you're going to have a positive history and you're going to see the rash. If you don't see the rash, unilateral is something that's quite spot on for this condition. And finally, never to forget, a full-blown panic attack. A full-blown panic attack can really mimic chest pain, and it will have all the sympathetic system involved in it, making it look like an emergency. So don't forget that, right? Now, chest pain, because you have the same nerves and the same systems activating when there's pain, it tends to morph from one to another. It's important to remember them in these systems, and it will help you get through diagnosing somebody with chest pain, at least not forgetting anything important. Remember to diagnose, not to diagnose. Remember to identify chest pain. You need to sort of know the nature and the region and the radiation and so forth, as well as the past history. But I hope my differential list makes things easier for you. That's all for today, I think. I hope so. I will see you in my next video. Till then, stay happy.